All right, let's turn our attention over to our good friend, Dr. Lee Weisbard, who's got a health tip for us today.
Absolutely. Dr. Weisbard, welcome to the Experience Pros Radio Show.
Good morning and happy Thanksgiving to everybody.
Well, thank you. Very nice to have you with us. What's our tip for today?
Well, holiday time is a great time for family and friends, and it's a wonderful time to give thanks for all the blessings we have in our lives. But one thing is we don't realize there's a lot of stress associated with holidays. And believe it or not, it's the highest incidence of heart attacks. And the research shows that a heart attack occurs every 34 seconds in the United States.
Wow.
Oh, my goodness.
And heart disease is actually the number one killer of women. People don't realize that. They talk about it as a men's disease, but it's not. It's a disease that affects all of us.
Wow, 2 heart attacks every minute happen in the United States. And does that number go up over the holidays?
It does. The holiday time, because of the added stress, seems to have a much higher incidence of heart attacks. So I wanted to just give some information for people about what to look for and what to do if they have these symptoms.
Absolutely. Please go ahead.
Well, for women, it's a little different than men. With women, it could be shortness of breath, pain or pressure in the lower chest or abdomen, kind of a faint feeling or dizziness, even some back pain and pressure, and sometimes it's just extreme fatigue. And the signs can be very subtle for women. So most women will ignore it, thinking, oh, I can't be having a heart attack. I just have a cold, or I'm tired, or I work too hard. But those symptoms can be much, much more important. And for men, it's a little more severe. Men will tend to have pain in one or both arms, the back, the neck, or radiating pain from the jaw. And a lot of times men will think, oh, I just have indigestion, a little chest pain. But if it lasts more than a few minutes or it comes back, I think it's a more serious symptom. They also may include cold sweats, nausea, and a little lightheadedness as well.
Does anything with not sleeping and a little acid reflux?
How about arrhythmia?
Well, you can have a little arrhythmia, a little tachycardia, a little, kind of your heart beats a little faster. But it's more of a pain or pressure in the chest than that irregular heartbeat that could be the sign of a heart attack.
Look at that! I'm trying to play a doctor on the radio.
She's looking at me.
Look at Eric's symptoms. I'm thinking, ooh, do I know something?
All right. So if we feel these symptoms, if we notice these things going on, either as a man or a woman, what do we do?
Okay. Well, first of all, it's caused when the blood flow that brings oxygen to the heart is severely reduced or cut off. And that's caused by the thickening of the walls of the arteries into the heart, and it's buildup of plaque. And it's not the same plaque as in your mouth. It's a buildup of fatty deposits. So what I want people to realize, don't disregard the symptoms. If you have severe pain, back pain, tightness, like you're being crushed, very dizzy, fatigue, they should call 911 immediately.
Okay, yeah, don't dismiss it because it is very serious. And the sooner you get checked out by a professional physician, the quicker your recovery could be, right?
Absolutely, correct. So the key is timing. You got to get to the hospital as soon as possible because the sooner they can treat you, the higher your chances are of getting through this alive.
See, this is good to be around family. I mean, it's kind of a catch-22 because you're around family. Your stress is up, but you've got plenty of people to drive you to the hospital.
Well, I'll tell you what, we need to drive right over to Dr. Weisbard's practice. Doctor, where is your dental practice, please?
Our practice is located on Bellevue, right off I-25 in the Denver Tech Center. We can be reached at 303-773-3373. or on the web at www.weisbarddental.com.
Love that. Give the phone number one more time, please.
303-773-3373.
Folks, pick up your phone and call Dr. Weisbard. Schedule your appointment just like I do. Dr. Weisbard, I'll see you next week.
Wonderful. Looking forward to it.
Absolutely. Dr. Weisbard, thank you so much because our health does matter.
You betcha. Don't go anywhere, folks. We've got more positive business talk right after these messages.
The Experience Pros are here to help you get your business right. To learn more, visit experiencepros.com.